Hey everyone, welcome back to Beat Your Addictions with me, John Giordano. Today I have my partner that we have our ketamine clinic. That's an incredible partner, very professional. She'll give you a little understanding of who she is. Callie, you want to give you a little background and what you do and how
Yeah,
you
sure.
started the clinic?
Yes. Well, thank you for nice introduction. My name is Callie Reed. I'm a nurse anesthesiologist, APRN, and injector, aesthetic injector in the clinic. So Sonia and I, my partner, we started this ketamine clinic in 2020. Um, we wanted to help our patients with suffering from mental health disorder with ketamine. Both of us are trained in anesthesia, so when we learned of benefits of ketamine during schooling, I always had envisioned that I can use this medication to help people. So after graduating and after practicing for about 3 years, we decided, let's open up a clinic because I just saw myself as, working outside of the OR because I do enjoy giving anesthesia. However, I had other passions in the future. So here we are, 3 years down the road. We have an amazing clinic in Pompano Beach, and we're offering multiple of services, which we're going to talk in here, I think.
Yeah, what we did is we want people not only to feel good, but to look good. And that's why we have our aesthetics that Callie's in charge of, that she decides to put it all together. And we're doing some really cool stuff. Uh, she'll explain to you about this non surgical facelift, which is like unbelievable the technologies that are coming out today. Callie, you want to talk a little bit about our aesthetics part of our place?
Yeah. So, about 2 years ago, a lot of our patients that we treated in the clinic, they would ask, "Oh, Callie, do you have any kind of Botox or any stuff to make me feel and look great?" So, I mean, I've always been passionate about makeup. At some point, I wanted to take a class for makeup artist. So I enjoyed doing stuff. So I've been using Botox and fillers myself within the last 10 years. I believe in preventative anti-aging care versus um, when it's too old and you're trying to catch up. So then a year ago, I took the class for Botox fillers, and I just fell in love with, making somebody feel great and look great. Then a few months ago, I want to say 6 months ago, we learned about non-surgical facelift called endolift. This was created in 2007 in Italy. It's called endolift Euphoton laser machine. So it was approved in US. FDA approved it in 2022. So we were able to get our hands on it, and we're excited to offer this service to our patients. A lot of our patients usually ask me, like, what can you do about my jaws or submental fat, just the, skin laxity around the neck. Usually with these type of, you know, um, changes with the aging, it's facelift is the common cure for that. So we're trying to prevent somebody to get facelift. So I'll go into in a little detail, and I have some machines to show you as well.
Okay, Callie, why don't you give a little explanation of how the endo
Yeah.
lift actually works?
Okay. So endolift is non-surgical laser machine that goes under your sub hypodermis level. So I'm gonna show you actually little picture. Maybe I can pull up the actually, I think so. Your skin has multiple layers: hypodermis, dermis, and subcutaneous area. So we put the little fiber under your hypodermis under your skin. We advance the fiber under your skin and shine a laser. In that process, you create a new collagenesis, which means collagen production. And in the healing process, the sagging skin laxity retracts. It gets closer to your fascial layer, which is closer to your muscle and your bone. So it works over about the best result after the treatment is 2 months and continuously work for up to 2 years. Um, I'm going to show you the machine. This is
Callie, let me ask you a question. Do you have to make an incision or you're making a little pinhole?
It's a pinhole, little
Ah,
skin puncture. We usually use lidocaine right at the site, and we advance the fiber under the um, skin, hypodermis level. And typically, in that area that we're gonna treat, we put a lidocaine cream, BLT cream, in there to numb it, and it's very it's not painful. I actually did 3 phases last Saturday, and each client, when I was doing it, each client says, it's tolerable. If certain area is sensitive, we change the setting down on the machine, and then we adjust it based on how the patients feel. Depending on the skin type, we can definitely change the settings.
and what's the downtime for this?
No downtime. So typically after the procedure, you can basically go to work, do your normal daily activities. Within 2 to 3 days after the procedure, there are some swelling. There could be some bruising involved, which is expected, and then it's pain free. We had one of our actually staff was my patient on Saturday, and she's here at work, and she's looking great.
Yes, she does. It's amazing what we do at the clinic. We do so many cutting edge technologies, but before we do it, we really vet it out to make sure that it is what it is. Because some people say, "Oh, this does this and this does that and does nothing." We're not into that. Same thing with our ketamine clinic. What we do is we do brain mapping now to show the client about the brain, the deficiencies in the brain, because you can see it through a QEEG, it's called. It measures the electrical output and different each quadrant in the brain. And then we do integrative counseling. We do group therapy as long as they want to coach. Everything we do is cutting edge. And that's why Callie is going to show you about some of these machines that we have that are like, you know, welcome to the 21st century. All right, Callie, go for it.
So this is the endolift laser 1500. So if you can see, there's a different setting. We have the ability to have a light
No, I
bulb.
think it's we can't see it that far. We can
Okay.
see the machine, but we can't see the. Well, you could tell us about it. You don't have to
Okay.
show us.
So endolift, that's the laser option. We can do full face, and we can also do full body. So this is a setting for lower eyes. As we age, we lose our fat pads under our eyes, tear trough, and we can actually laser that area so the skin is tight. This is the cheek. It just all these functions are related to aging. When we age, our structure of the face becomes wider in the bottom versus used to be in the youth. We used to have a fuller cheek, wider um, upper mid face. So as we age, everything kind of droops down. We get wider jawline and wider neck. So this product will aims to make that tighter. So we can do mandible, which is your jaws, um, under chin. We have the option to do lipolysis of the submental fat. So a lot of people, when they were heavier, they lose weight. They end up having more fat pockets right underneath the chin. We have the ability to laser that, create a breaking off the fat cells, and then we can actually put a little catheter in there and suck out the fat. um, it's amazing product. And we can do the neck, you know, as we age, also our neck kind of shows our age versus the face. So if you look at somebody's face, they look amazing, but if you look at the neck and hand, you can tell how old the person is in general. So we can take care of that. And also we can do body, which is sometimes we have this loose skin after we lose a lot of weight. You can get it under your arm, abdomen. You can also do it on the knees, ankle, pretty much everywhere you can do it. Only contraindication with this product is somebody who has any kind of bleeding disorder, um, somebody who we have a couple criteria. You know, somebody's hopefully not pregnant. We can't do any of this product. You know, um, it's it's amazing. It's safe, and it is a rapid result within
Well,
2 months.
what's interesting. Everything we do at the clinic, we make sure that everybody, if they're the right candidate for anything that we do at the
Right.
clinic, we don't just, say, oh yeah, come on in, it's okay, just go sit down. That's not the way things are done medically and professionally.
Yeah.
Also, Callie, what we could talk about is some of the IVs that we do, and all the other things that we do.
Yeah. So we offer IV vitamins in our clinic. So during COVID, I was actually part of the COVID team in Tampa. I was a locum CRNA, which is contracted to work for the hospital when they are in need of staff. So I was actually one of the team member who would go to ICU or ER and intubate the COVID patients. I would have this huge mask, goggles, and bunny suits on. So we try to prevent ourselves getting sick. During that time, I was giving myself immune boost IV bag every 2 weeks. Boost is vitamin B complex, high dose vitamin C, zinc, magnesium, and calcium. All the minerals and vitamins we need in our body to maintain our health and then boost our immune system is in there. So I was giving myself immune boost every 2 weeks. Doesn't matter if I was sick or not. I just more a preventative measure, and I actually never got sick. A lot of my colleagues back in Tampa, they were more older, so they weren't. They felt unsafe to be taking care of this COVID patients. So I mean, I was preventing myself with the immune boost. I knew I was gonna be okay. So it's amazing. When you are feeling sick, if you have a cold, you get immune boost infusion. It will cut down your time of being sick by half. So let's say
Well,
you're gonna be feeling for like sick for 2 weeks. It will cut it down to a whole week. What zinc does is it prevents the viral replication. So virus is they have this timeline that who's it's gonna infect you. It's gonna
yeah,
mutate.
but what makes us different is, and that's what I noticed. That's why I went partners with them. Is we don't just get vitamin bag off the shelf. We create it ourselves
Yeah.
in our medical room. So this is everybody's an individual here. Some people may need a little bit more of this, a little bit less than that, and we look at that also.
Yeah, we
So
we don't we don't just give you like in our immune boost bag we have certain dosages of certain products. So let's say if you had magnesium with your ketamine that day, we actually not put the magnesium in your immune boost. You typically a lot of our patients, after their ketamine infusions, if they are a little tired, they end up getting some immune boost and Myers cocktails. So we're happy that we have it available here. So whenever our patients request, we give it as needed. Actually, another thing is we have a weight loss, medically managed weight loss program with us. I don't know if you guys heard of Ozempic. Another name is semaglutide. We have that in our office. It's been doing amazing. So I
yeah, a
can,
lot of people. I couldn't believe. Well, I could believe a lot of people looking to lose weight, and everyone wants a quick fix, and so this really works and really helps everybody because I know because people keep ordering it. So if it didn't work, I don't think they would order it.
Yeah.
What we decided to do at the clinic is it's like a family there. That's how the employees are, us as owners, and we take care of each other. And not only that, when the patients walk in, they usually say, wow, it's so calm in here. It's so relaxing, and that's the kind of environment that is necessary when you're going on a journey into the subconscious mind. And what most people don't realize that ketamine also what they found out that it also grows new connections in the brain. So even if you don't think you saw anything in your journey, um, it's the work is already being done. So that's another thing that some people don't see anything. Some people see their dead grandmother. Somebody's, everybody sees something different. But everything that you see or don't see, there's a reason for it, and that's why we have integrative coaching. Like Callie will talk to some of them, like when they're in the room, and everybody's very attentive. Everybody's on a heart monitor. Uh, we look at their oxygen levels, you know, their blood pressure. So everything's done very professionally, and it's not done like come in and leave. Now you get integrative counseling for 2 hours included, group therapy included, no charge. You can come to group as long as you want. So those are some of the things. Oh, why don't you, Kelly? Why don't you tell them about the stellar ganglia block?
Yeah. Hold on. One more thing. So last week, I actually did a consultation with one of the potential patient that he was very anxious. He wanted to get a referral from his psychiatrist. So his appointment was about a month away. So I actually told them, hey, come by during the group therapy because that way you come and check out what John and Michelle provides. So, and then you get to see the office. So if you have, if there's some patients who are interested in coming and checking it out, feel free to come by because just him coming to see us, meeting everybody, made him feel comfortable. And this therapy, it provokes anxiety. For somebody who's suffering from anxiety, they're going to be anxious regardless, so it just brings them to their anxiety level down, that it's they can have hope to start a new treatment. um Stellate ganglion block. So after COVID, people during COVID, when somebody catches a COVID, they didn't have smell or taste. For some people, about 10% of these people, their taste and smell never came back. So during COVID, I think end of the COVID, one of the CRNA, I can't remember his name. He's in out of Texas. Discovered that stellate ganglion block reboots our parasympathetic nervous system, so your taste and smell comes back. So we learned about that. My partner Sonia Cotto, she researched it herself, and she brought the stellate ganglion block to our clinic. What we do is we use ultrasound. We look at your stellate ganglion nerve chain, which is travels right next to your spinal cord. It's behind the thyroid gland. We use ultrasound. We numb the area, and we drop in a local anesthetic. Sometimes we use lidocaine based on the symptoms. We will use preservative-free lidocaine or ropivacaine to numb that stellate ganglion chain, which is a nerve bundle that controls or sympathetic, fight or flight, or parasympathetic, which is rest and digest system. So when we put a local anesthetic there, it helps to basically stop all your sympathetic nervous system running, and it boots your parasympathetic rest and digest system. In that process, your smell and taste comes back.
Absolutely, because I did it because that's why I learned about it.
Yeah.
I lost my taste and smell, and everything tasted like cardboard. And then Sonia did it to me, and I got my taste back within 3 or 4 hours.
Yeah, and yeah, we had people who will stay, eat some chocolate, and they're like in tears. They're like, "Oh my god, I haven't tasted chocolate for months." Um, we actually had a couple people come down here from like Jacksonville. Somebody came from Ohio. I can't remember. There, we treated a lot of people, or Sonia did.
Right. And
Yeah.
We added. We have another couple of places that are actually opening up. Another two clinics we have. One in Miami Beach, and one in Hallandale, and that'll be happening by I think the second week in April.
Yeah, we at least in Hallandale Beach, we should be able to open our doors to clients first, yeah, second week of April. Miami Beach, we're hoping end of
Excuse me.
April. So
Well, and we want to listen. This stuff works. We don't want to, just like a business. Take your money in and out. No, 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 no. We're helping God's kids, and it's okay to have a business and help people too. So the bottom line is that everything that's done, it's going to be a standard across all three clinics. We're training the nurse practitioners, the anesthesiologists. We want to make sure everybody is very gentle with people that are coming in because they're suffering from anxiety and depression, and they're very anxious, and sometimes they get very angry because they don't want to feel the way they feel, and so the whole staff is trained to speak to people in a way that's soothing, um, and I think that's really important, and that's what most people come there say.
and
They-
I want to chime in that we ask and offer to our staff that if they wanted to try ketamine, we let them, because we want our patients to know, we know how you're going to feel, how vulnerable you're going to be, because um, it's scary for some people. So if we went through it and we tell you it's okay, trust us, I guess, because everything I we have in our clinic, I probably tested it on myself.
I
Sometimes
know I did.
down. um,
Listen, I'm Italian, but they keep calling me a guinea pig. I don't know what that means.
because we want to make sure everything we offer in our clinic is safe, and we always
Oh, so you're using your partner as
we know, we
as,
know we
as
know
an
it's safe,
experiment.
but
You see, this is what I call a good partner, ladies and
yeah.
gentlemen.
And another thing I want to say is that this patient's explanation of his ketamine infusions really stuck in my head, because this is what it feels like when you go through ketamine treatment. So let's say you are in your mid 40s, you're struggling with mental health disorder, you had been struggling for a long time, it started from childhood. So what he says was, when he was growing up, his parents getting divorced, getting bullied, and had a traumatic event during college life. All these events in his vision of tunnel put a lens in front of him. During ketamine infusion, each time he got an infusion, one layer of lens came off. Second infusion, the layer came off. Each time, so he went through sixth infusion, and then at the end of the sixth infusion, he had the clear vision in his vision of who he was, what his passion, what his hope was, because um, before that he had no clue who he was. He always had this story of himself that you know carried his past story with him. He was letting the past story affect his future. So at the end of this treatment, he actually had a passion for the future. He no longer want to be the person who let his past dictate his future. And when I've had ketamine infusion myself to experiment, because whatever I have in the clinic, I try it myself. And after that, I see what he means, and it just keeps you humble, I guess. Also keeps you true to yourself.
Well, a lot of people, and I know, and I'm one of those people that push back about ketamine because, it was a club drug, Special K.
Right.
And there was concern was that, oh, people were going to come to these clinics and get high on, try to get more high outside. But according to what I'm hearing and what I'm seeing in the last 3, 4 years, that wasn't the case, you know? And we opened it up, and I don't see that either. And it's different when it's done on the proper way with the proper professionals, because this medicine really helps people. Because look, my wife, that's is another reason why I went partners here, because of the care she got. She has suffers from bipolar disorder, and this happened that her medication wasn't working again. Okay, so we went and we did the ketamine, and it helped her tremendously. And I was sold. I said, "That's it." I mean, for me, and I watch how it's going, and the care that's being given, and you get boosters once a month, every 3 months, every 6 months. Some people don't even need a booster, so
Right.
everything is different. You know, so for those out here who are wondering about it, look, this is a godsend as far as I'm concerned. The psychedelic medicine is, and all this plant medicine. People were pushed against it because it was misused, just like any other drug. People misuse SSRI, trazodone. They take 3 or 4 of them, trying to get high on them. I mean, uh, not true.
Yeah. So we typically do drug screening before we start the patients, just to see if there's any kind of drugs there. We're looking for a PCP in general. We understand that a lot of our patients will be using THC,
Well,
medical
PCP is
ketamine.
ketamine, so people
Yeah,
don't know. Okay.
yeah. Um, we understand patient will be on benzodiazepine, which is Xanax or Valium. We understand because those are medication are used to treat anxiety, but those are short term treatment plan. It doesn't get to the root cause of the problem. It's more like a band-aid. So we typically test our patients beginning of the treatment, and then after that we just want to have a baseline of lab values. um, but we have treated patients who's done at home ketamine. They didn't work for them, and then they came to us because for those patients we would test them, make sure they don't have any oral ketamine in their systems, because if we give it to them high IV, and then if there's a ketamine at home oral lozenges in their system, we're going to give them too much, so we have to take precautions.
Yeah,
We
but one thing I want to make clear: we do not give anybody lozenges.
Yeah.
That at home thing is changing because now they have to come into the office with these other clinics. So we don't do that kind of work. Um, we do
Well,
infusions.
so let me tell you about why oral ketamine doesn't work. Because so when you ingest any kind of medication, you always want to look at bioavailability. When we give you IV ketamine, bioavailability, the amount of medication, the ketamine you're going to utilize in your body is 100%. IM, which is intramuscular, that we give injection in the muscle, it's 93% effective. It's pretty similar. Also, oral ketamine is only 30% of bioavailability. What that means is you ingest the ketamine in your stomach, in your mouth, let it digest. It goes through your GI tract, your liver first pass effect. 70% of that ketamine is metabolized out. So you only get 30% of that. You don't get the floating or psychedelic effect. It's more like a band-aid in our eyes, because you don't get to your subconscious level. And also at the 30% level, you don't create that new neural pathway that we talk about, neurogenesis. It doesn't happen. Also, the nasal ketamine is about 6% to 70% bioavailability, depending on your anatomy. They spray the ketamine, you don't get the 100%. So our belief is gold standard of ketamine treatment should be IV or IM. IM is for people who are extremely terrified of having IV started, because we've had patients like that. So in that situation, we offer them IM.
Right.
So
You, you know,
sorry.
the sad part about what's going on with the ketamine movement is that some of these clinics were opening up just to make the money, get the clients in, get the clients out. No therapy or very little of anything, and it's sad because you're messing with people's lives and just to make a dollar. I mean, go sell drugs then. If you want to really mess, at least you're cohesive in what you're doing. Um, it's not that hard to do it right. It really isn't. And doing it the wrong way, that karma comes back to you. So that's just a message out there for those who own clinics that are not really doing what they need to do. That's
And also, look at the people who started this clinic. What's their passion, though? Because my passion is that I'm from my background is Mongolian. Um, in our culture, mental health disorder is non-existent. So let's say you say, "Oh, I feel depressed. I don't feel well about myself." My grandparents would tell me, "Get a life. You're weak. What are you doing?" So that was the culture I was brought up, and I grew up with a family member who struggled with depression for a long time, and he had, unfortunately, he jumped off the building when I was younger. Had this medication was available for these people at that time, if the culture was there, he could have been still alive, or. So that kind of helped me find my passion working in mental health industry, because I used to have a family member who suffered this. And I believe with this medication we can help so many people. When I hear about all these stories about the latest one, the US pageant, former pageant, who lived in New York, killed herself, I just it broke my heart. Like, if somebody reached out to her and then offered
yeah.
this medication, this could have
Well,
been.
we're Callie, we're down to the wire here.
Oh, okay. Oh,
All
wow.
right.
Okay.
So anybody out there, I know it was kind of medical for some people out there. It's not the regular thing that we do, but look, we're doing our best to give you the best information for those who are thinking about doing the things that we spoke about today. The numbers on the right on the screen there. So call. If you want to know who I am, you can go let me know who I am. So go to johnjgiordano.com. I'm still trying to figure out who I am. Anyway, thank you for watching, and you guys have a wonderful day. And don't forget to click and press all the right bells and buttons so we keep coming up there so people can keep watching this. Thank you.
Yeah. Thank you. On April 15th, we're gonna do live event on Endolift. So if you wanted to come and check it out, let us know. Give us a call.
Yep,
Space is limited, but
41 North Federal Highway, Pompano Beach, second floor.
yeah.